Thank you for plugging into this Family Life News podcast, streaming issues-driven, family-focused news.
Welcome back to another edition of Real Answers with Chris Anderson, Wednesdays during the Noon Report. We tackle the tough topics facing today's families with licensed mental health counselor Chris Anderson. And today, Chris, we've got a conversation with a local pediatrician about the challenges facing people living in rural areas, which, you know, our listeners definitely are in many of these different areas. Yeah, we definitely can relate and qualify. And in respect to getting medical care.
So true, Brandon, and I'll tell you what, I am very glad we have this opportunity to address this critical topic. And I sat down recently with Dr. Marlene Wust-Smith, and Marlene is a pediatrician from the Coudersport, Pennsylvania area down in Potter County. And I asked her about these challenges that people living in rural areas face when they're trying to seek health care.
Marlene, you've worked in a variety of geographic locations, from the Hamptons on the eastern Long Island to California. So, well, here you are in the middle of nowhere.
Yes.
In northwestern Pennsylvania, southwestern New York region. Very different from both the Hamptons and the West Coast, wouldn't you say?
Actually, not as different as you would think. One of the things that my husband and my daughter was little at the time that we loved about the Hamptons is that 9 months out of the year, it is rural as rural could be. And they're called Bonnickers, local year-round people who back in the day were fishermen, worked the land, and the Hamptons became the Hamptons. And the need for my services as a pediatrician was primarily in the summer months because the place becomes invaded with very wealthy people with their families. But 9 months out of the year, there's still a lot of children there that need services. And we love the very rural kind of low-key life. It changed a lot after 9/11, which is one of the reasons we left, because a lot of people panicked and moved their families out of the city and to their beautiful homes that they only visited on weekends and in the summer full-time. And then it became not the value system we wanted to raise our daughter.
Sure.
But it was interesting because when we moved to Coudersport, the recruiter said it was close to Rochester and Buffalo. They don't tell you the name of the actual town until you commit to the interview, and we left. I was here for 4 weeks before I actually left Coudersport 14 years ago, and I said, I'll just go get my nails done at the mall in Olean, not realizing it was Olean. And then when I got there, I'm like, Jim, I don't know where we moved to. This is not a mall.
Sure, exactly. So being in a rural location now, what are the challenges that you're seeing with respect to rural health care and what families face raising their families in an area where health care is lacking?
Right. So it's a geographic issue. So people have needs, medical needs, especially specialists are scarce. In New York City and any major city, you're going to have 3 to 4 to 5 specialists of the same kind in one block radius, depending on which hospital they're affiliated with. Out in rural areas, that just doesn't exist. There's a shortage of primary care physicians. It's predicted that it's going to get worse and worse. I don't know if you're aware, but the government has not funded a single residency position since the 80s. So every year there's 7,000 to 8,000 doctors that graduate medical school with $250,000 to $500,000 in debt that cannot match in a residency.
Wow.
And we're having fewer and fewer doctors go into specialties because of the low pay of primary care. And I'm biased because I am a primary care physician. I'm a pediatrician by training, but I feel that the most important person is the puzzle solver. Everybody's important in medicine, but take your family practitioner, your internal medicine, your pediatrician. It may look boring, but we have to know a lot in order to pick out who's not normal and how to reassure. And your field with the intersection of physical health and behavioral health is huge. So we require a lot of skills, a lot of training, and the pressures are getting higher and higher to do more with less, to see volume instead of quality care where you get to know your Norman Rockwell poster is why I went into medicine. I want to know
You want to know your patients.
Yes.
Sure. Well, you mentioned too that you're a problem solver, and you definitely are. How are you involved in affecting changes in the world world of medicine with respect to your area of expertise, but also in these rural areas. And I mean, you are a problem solver. Tell me about some of your own personal initiatives.
So I stumbled upon a group of physician, we call ourselves the MedVengers, people that were just fed up. You turn around after spending your 20s and 30s in training, I hear more and more every day about doctors looking for their way out of medicine. And my generation should not be looking to retire in their 50s. I'm 56. Right. I should be having 30, 40 more years. That's the model I grew up with. Most doctors that die in their offices or working because they love what they do.
You see patients before you go to your funeral, right?
You do. And so whatever is that's happening now, and it's in the last decade, and you're seeing it not just in physicians, it's in nursing, it's in teachers, and my theory is that it has a lot to do with technology and the overuse of technology where you're losing that personal connection. In medicine, at least, we threw a lot of money at electronic health records when the Affordable Care Act, or Unaffordable Care Act, as I like to call it, it was a free-for-all, and a ton of money was thrown into the High-Tech Act, and people just put together EMRs, electronic medical records or health records, that do not meet the needs of the patient and definitely don't meet the needs of a physician. I went from being a doctor that used my brain to a data entry clerk. And the burnout that comes from that, I thought I was alone, and this was about a decade ago. I had come to Coudersport, Pennsylvania, a very rural town, where we were still on paper in the day, and there were long days and more diseases than I've ever seen, even in New York City. Wow. The pathology in rural towns and communities is tremendous. Every pediatric condition that I had ever read about, I saw here.
Wow.
And it's odd because you'd think, I was at Memorial Sloan Kettering, I was at New York Hospital, and thank God I had good training. Even in my own family, my daughter ended up with something that affects 1 in 250,000 children.
My goodness.
Had never seen it.
You would have never, like you said, you never thought of it. You think, country areas, clean air, fresh, everything's, but that's not the case.
And I think it probably has a lot to do with genetics, that families settle here, and there's probably some genetic intermixing that you don't realize.
They don't realize what's happening.
From generations past, but... and the environment and whether fracking, who knows what's happening, but I feel like multiple sclerosis is much higher. It's not my area, but you hear about much more breast cancer and MS and other autoimmune diseases in rural communities, especially when you think about the density of the population. You shouldn't have something that's 1 in 200,000 in an area that has 40,000 people.
Absolutely. Well, you mentioned, again, almost like a technology burnout.
Yes.
That's complicating the provision of services so much. Tell us a little bit about this technology influx you're seeing about, for example, seeing a doctor through the internet.
Yes.
Face-to-face online.
So there is an example of technology that can be used for good. So instead of just becoming burnt out over the last 10 years, I've decided to take action and join forces with a bunch of other doctors who were fed up, and we weren't aware of what was going on in medicine, and we've all kind of taken our little path to see what's going on and try to affect change before it's too late. Because I don't know how you feel about it, but when I hear Medicare for all, I just hear that we are going to trap people into bad care with less and less choice and poor quality. Every day you hear about more and more replacements for physicians, poorly trained replacements, and it's making somebody money. It's not good care. That's not the model of care we should strive for. But an area that I became involved with now, probably going on my 4th year, is the use of telemedicine as a way to connect patients with physicians. So I work for a company called Doctor on Demand, which employs physicians so patients can see a physician and talk to them face-to-face for 15 minutes and get real advice. A lot of times it's just helping them figure out what it is they need to do and talk to a specialist, whether they need to talk to a specialist or I'll direct them to go back to their primary care. It can get frustrating because a lot of people in our society just want the quick fix. They've got a cold, they want an antibiotic. Well, guess what? Antibiotics don't work for colds, and it's dangerous to give them. So sometimes I have to spend the 14 out of my 15 minutes trying to convince somebody that what they need is to be seen in person if they really think they need that antibiotic, and how to give themselves good self-care.
So there's definitely pros and cons.
There is.
To seeing a patient through the internet as opposed to face-to-face.
Yes, but it has its place. It's better than a phone call where, you're a new dad. There's going to be a day where you're like, do I need to be seen now? Is he breathing okay? Better than calling someone to have that internet face-to-face if your Wi-Fi works. To have somebody assess, that's a pediatrician, assess whether breathing is something that can wait till morning, or is this something that needs action now. So there's a benefit of it, but there's no way I'm just going to, somebody in distress, just give treatments without being able to lay.
Sure. So patients that choose to use that technology, that it helps them again to decide whether or not they should get to like an ER or an urgent care, or whether they can wait.
But
till
you
the
said
morning.
an interesting thing. Choose. I find it unconscionable now what's happening. Again, we take a good idea and we corrupt it for profit. So Walmart is one of our biggest clients for this telemedicine. And you don't meet a harder working group of people. They're the working poor. Obviously, it's getting better. Years ago, they would complain that they were being paid so low wages that most employees were on Medicaid. So now I guess they're insured. That's, I guess, a move in the right direction. When I see a Walmart patient, at least in some parts of the United States, they only have to pay $4 or a nominal fee to see someone on Doctor On Demand. Now, if they have an earache, I can't diagnose an ear infection unless they happen to have a digital otoscope. Well, who in their right mind has a digital otoscope if they're new parents? So I will tell them, I'm sorry, we can't see you for this or your child for this. You need to be seen in person. It's $40 to $50 for this family of 5 to stand online at a doctor. It's not a real doctor often. It's a urgent care. They'll charge them $40 to $50 for that visit. And they can't afford it. It means they don't eat that week if they have to be seen in person. So I've had families order a digital. It's less expensive for them to order a digital otoscope, give their child Tylenol or Motrin for the night, and have me see them the next day. Because I know they're not even going to get good care. They can't even see their own doctor for that $40 or $50. They're seeing an urgent care where they're going to pick up the flu. So that bothers me. I wish there was a way for me to say, look, this patient really needs to be seen in person. Let's credit them something. Let them go in. But the profit. They're still making profit at the top.
Definitely pros and cons, but to some degree, definitely online is meeting a little bit of a niche.
Yes. And for specialists, it would be ideal. I don't know if you are aware what's happening. If I refer a patient to a specialist, they often have to wait 2 to 3 to 4 months, and then you get there and you're seeing a PA or an NP, and you might see the doctor. They're usually signing off on your note. I think it's a better use of technology than let me stay in my own town, especially in rural areas, and let the doctor, a real physician, a board-certified trained neurologist, or whatever specialty you need, see you face-to-face and provide that opinion. Because if I'm seeking a specialist opinion, I've exhausted my years of training. I want to hear it physician to physician, not the bottom line. The problem is the PAs and NPs are getting a lot of bogus consults, and so the physicians don't have the time at the big centers. So now that's your front line. So it may be better in the future to see your specialists through telemedicine.
So you have a trip to Florida coming up.
Yes.
Don't you?
Yes,
this is exciting.
Yes.
Tell me a little about what you're going to do down there.
So part of the group that I belong to, and I try to remain as
politically neutral?
Politically neutral, because medicine is not a...
It shouldn't be politicized.
It's not. It shouldn't be. But I happen to work with a group that is very connected to helping this administration. Say what you want about President Trump, but he makes things happen and change. If we're going to see an improvement in our healthcare, this is the time to do it. And sitting around this table, hopefully we're supposed to wear our white coats to an event with the president, I believe on March 8th. And it's a fundraising event because it's an election year, but it is organized by a group that is passionate about free market choice, passionate about helping the poor. Everybody always says that the right just doesn't care about poor people.
A lot of mischaracterization.
And the reality is if you are able to give choice, and it happened in Indiana, Medicaid was made more like the model that I hope we can see, so that you don't just abandon the poor. You actually empower them to demand good care, and their dollars count. One of the best things that happened with healthcare, nobody used to take Medicaid. So that over the years, one of the advantages I see, some good has come with all the consolidation, is that Medicaid is accepted at the big hospitals, at UPMC, at New York Hospital, at Mount Sinai, but it's now dumbed down care for everybody, and that's what I detest. That means that we're not getting good care. It's like a mediocre care for everyone. It's not thorough. We reward volume over actual valued evidence-based care. And there's a way to do it, to do both, and I love meeting people who have ideas. There's a doctor down in Texas who His name's Brian Dixon, Dr. Brian Dixon, and he wrote a book called Forget Obamacare. He's very, very liberal, but his model, I think he's a free market, believes in the free market, and
provides choice,
competition, and
quality,
and what he calls the Costco model of care, where every state, so you would respect the sovereignty of every state. Every state would get federal dollars, and a board of each state would be comprised of patients, physicians, all the stakeholders, insurance companies, and each state would carve out their own version of what healthcare would look like.
Well, hopefully we can see some of those trends take place nationwide. That'd be good. Well, Dr. Marlene Wust-Smith, thank you so much for taking the time to be with us today.
Thank you. And look for, I'm launching a magazine online and print. It's called Physician Outlook, or physicianoutlook.com, and hopefully we'll be able to discuss a lot of these topics in the magazine and
excellent.
Engage patients and physicians.
All right. Thank you, Dr. Smith.
Next time, Brandon, on Real Answers, we'll do a follow-up, actually, about what you can do to be, let's say, a good patient. In other words, you get into a primary care provider, and we'll give you some tips on how following these guidelines can help you maintain a good relationship with your primary care provider.
We look forward to exploring that once again in the next version of Real Answers. You've been listening to another edition with Chris Anderson. Of course, it airs Wednesdays during the Noon Report. We tackle the tough topics facing today's families with Christian counselor Chris Anderson.